Well, who is? Every person with an insurance policy will be paying for that. Just look and see how much an aspirin will cost you if you happen to go into the hospital. That's because you're paying for those people who don't have insurance. So there are great things in this bill for people with insurance. But I would caution people with insurance about one phone call I got from a lady. I was doing a radio program. She called in after a person was castigating me for threatening the good insurance policy that he already has. She said to me, she said, you know, I want to tell the gentleman that called in earlier, maybe he likes what he has because he's never tried to use it. But when he tries to use it, he may find out that he may not like it. This lady was a victim of breast cancer. And she found that the moment she contracted this illness, her insurance company dropped her coverage. And so we're saying that this kind of stuff for you with insurance, that will be illegal immediately when the president signed this bill.
There's also a lot of misinformation going out about Medicare, and it's kind of a scare tactic to our seniors, saying they're going to cut so much out of Medicare. The part that I saw in the bill, I didn't see cuts in Medicare for individuals.
No, no cuts for individuals. What we've done, we've modified that part of Medicare that's paid out to providers in order to squeeze out the kind of abuse that all of us know exists. How many times do we pick up the newspapers and you see some reports of some scheme using Medicare, the Medicare laws to carry out some scheme, some fraud, some abuse? We are looking at that side of Medicare, so making sure that we put in place procedures that will protect against that. The studies that have been done indicate that there are billions to be saved if we police that part of Medicare more carefully, and also we'll be passing on some of those savings to the patient side of Medicare. So there's a big benefit in this for patients, but the cuts that you see are cuts that are on the provider side. Now, the interesting thing about this is I just saw a survey of AARP members. Almost 70% of AARP members say that they like this bill and they support this bill. That means that there must be good in there for the client side of Medicare, or they would not be supporting this bill, I assure you.
It took them a while. They had to read it and understand that whole bill before they took a position, which I can appreciate. But when they did take the position, it was in favor
of the bill. Absolutely.
The people who are really familiar with this bill are very supportive. Back in my district, where we have very, very high premiums, the people are looking forward to the implementation of this bill. And I had so many congratulatory messages and coming, and roses were delivered.
Oh, yeah. Absolutely.
So people are very pleased to see that they're looking toward a better day for their health care.
They're very pleased with it, and I'll tell you, I was quite surprised. As you said, we voted on the bill around 11:30 when it was all over, and of course there was a lot of celebration going on in various offices around. I had to rush home on that evening because I had an early morning flight going to Jacksonville, Florida, where I was meeting with people both in the energy programs that we hope to get moving on real soon, and the next day with CSX railroad people. When I walked into the restaurant, as soon as I got into on Amelia Island, Florida, a lady recognized me, and she ran over, and she was so emotional. She had set up the evening before. She watched all the voting, and she was just caught up in it. And she told me that she could not stand that 220 and knowing that we needed 218. She was so afraid that we were going to come up short. So people all over the country were emotionally involved in this effort, and I'm very pleased that we were able to successfully successfully deliver on their behalf.
Yes, I had lots of people tell me that they were watching the deliberations as they went on, and how pleased they were that we had the votes. It was kind of tough getting the votes.
It was tough. This was a very emotional issue. I suspect that there is not a single family in America that's not touched by this. When you think about some of the things we'll be doing immediately, children with deformities will be covered for health care immediately with this bill. No matter what you can think about, diabetes, the ultimate pre-existing condition, touches almost every family in the country. So people were emotionally involved with this, and so that's what made it so tough, because when you talk to people, you have to sort of listen to their stories, trying to make sure that vision care got as much attention as hearing. All these things, all these moving parts made this a very emotional effort.
Well, in our public hospital in Dallas County, we had over $500 million in 1 year for uncompensated care. And it was 90% of it people coming to the emergency room for sick care.
Absolutely.
Because they did not have a physician and did not have insurance. Does this bill do anything to address that?
Oh, yes. Primary care gets tremendous attention in this bill. But the thing that I like about this bill as much as anything else is the fact that we will more than double the number of community health centers that will come online. Today we have around 1,100 community health centers in the country. We go to more than 2,400 community health centers with this bill. We think that that is the best way to get people out of emergency rooms, out of all this uncompensated care that we suffer with in the system. If people can have community health centers in their communities so they don't have to go to the emergency rooms for just primary care, and that's what they're doing. Little things like a child slamming his or her finger in a door, having to go down to the emergency room, these kinds of things you can take care of in community health centers. So I think that this is one of the biggest efforts that we put forth in this bill.
And it helps, it should have classes, or will have instructions there, that would help people take on the responsibility for some of their own care.
Sure. The community health centers, I think, are the best vehicles for prevention care. That we know will save billions of dollars in the system if we bring on more prevention. And to have these kinds of centers, I know in the communities that I represent, the community health centers are godsend when it comes to helping families deal with issues of prevention, employing good practices at the community level. These things take pressure off the system and save billions of dollars nationwide.
Well, diabetes, for example.
Sure.
The community health centers can teach people about the diet, their hygiene, how to avoid making the diabetes worse, the dosage of insulin if they have to take insulin. There's so many areas of relief for people that do not have a physician, and those that will go to the emergency room for care when they become afraid or become too sick. And sick care is very, very expensive for an emergency room. That is the most expensive care, because you've got all the specialists there. And if you go in and you don't have a relationship, they don't know what's wrong with you. We don't have electronic records right now, but that's also high priority, so that we can find out if the people have a history of certain things. That eliminates a lot of tests that become necessary when they don't have a history of the patient.
Absolutely. I'm glad you brought that up. I don't know why I forgot that part.